Welcome to Riverside Methodist Hospital. The OBGYN residency has put together this quick virtual tour to show you what life is like here at Riverside.
This is the Riverside Women's Center, where we come in every day. It houses the maternal fetal medicine unit, which has our ultrasound department, genetics, diabetes education, and our entire labor and delivery suite.
One of our labor rooms. We have 20 laboring rooms. They all are pretty similar to this. They have a bed, their own bathroom. Every room has a warmer for deliveries to put the baby in. And it's right next to Triage in our Antepartum Unit. So everything for the women's health building is all on the same floor and close together.
Just down the hall from our labor and delivery and our Antepartum Unit are our ORs. We get scrubs over here, unlimited access. And through these double doors, we have 3 ORs that can be used. We usually keep one open for emergencies. And then we also have a PACU down the hall where patients will go after their C-section.
This is our triage. We have 7 triage rooms. These are our triage nurses. They're fantastic. Here's a room. Here. And then we also have an ultrasound that is always on triage, as well as a microscope to look at burns.
This is our Antepartum Unit. We have 12 antepartum rooms. There's a bed, there's a couch for the support person that turns into a bed, and every room has its own private bathroom. They're very nice. Patients stay here for up to multiple weeks or months. We also have an ultrasound that is always on the Antepartum Unit. And new to our Antepartum Unit, since it moved to the 3rd floor with labor and delivery and the ORs, we also have a neonatal resuscitation room for any kind of emergencies or NICU overflow.
This is the nurses station on our Antepartum Unit.
The nurses rock. We love them.
This is our high-risk conference room. This is where we do sign out every day.
Welcome to our OBGYN resident clinic. Our clinic has wonderful clinical support staff, including medical assistants, schedulers, nurses, and social work that help us assist our patients. Our office has 16 patient rooms, 4 of which can also be ultrasound or procedure rooms, where we can do first trimester dating ultrasounds. We also have colposcopy and in-office LEAP procedures. So this is our wonderful clinic workspace where we staff our patients with our attendings. We also have an amazing nurse practitioner, Melissa, who sees our patients and works very closely with us as well. One of the great features of our clinic is we have a surgery scheduler, Betha, who helps us schedule our surgery cases for our clinic patients. This is a really cool feature of our program, that you get to follow patients through clinic and get to do their surgeries as well. We also have a lab here in our clinic where we can do wet preps, do ferns, and we have a lot of other equipment that we can use as well.
Here we have our Center for Medical Education and Innovation, also known as CME&I. Here we do a lot of our simulation training.
A lot of the intern training we will do here towards the beginning of the year, then we have simulations and modules that we'll do throughout the entire year. So go ahead and take a look. So this is one of the rooms in the CME&I. Here you can see Yuffie practicing her ultrasound. We have a mannequin here that allows us to practice first trimester ultrasounds as well as level 2 anatomy ultrasounds. And we also have 2 robots that we can practice on as well. They contain modules for each level class that you should be able to achieve.
Another part of our training here at CME&I is practicing suturing and applying.
Here we have a couple laparoscopic trainers as well, and we practice for the FLS on these machines, which you generally take in your 3rd or 4th year. This is one of the classrooms that we use for lectures on Tuesday mornings.
There's plenty of room so we can all sit 6 feet apart.
Here is a patient simulation room where we practice patient encounters.
What brings you in today?
Well, Doc, I think I might have missed my period. Could I be pregnant?
Here's another area of the simulation center where we can practice patient encounters and watch them.
So this is an example of one of the mannequins that we have here. They can be programmed so that they can have real life, like up-to-date functions. For example, they can have all their vitals and fetal heart tones or etc. on here, so it can really put you in a simulated environment to learn from. We also have the Noel doll too.
A great deal of our didactics and learning takes place at the brand new Gibbons Conference Center. This is dedicated space for resident learning, and there are also clinical workstations for us to do notes, documentation, etc. We also have large lecture halls where we hold our weekly didactics. And then there are also medium-sized as well as smaller conference rooms for us to meet. We also utilize space in the medical education department for daily meetings and didactics. There's also a dedicated medical education library with textbooks, academic journals, and librarians that are always willing to help us in a timely manner with literature searches and obtaining journal articles we may not have access to otherwise. Within the library, there's also private study rooms where we can do documentation or study for tests.
So here we are situated sort of near our parking lot and parking garage. We're lucky enough to have free parking where we have a lot that's restricted. So there's always spots. It's a short walk to our labor and delivery entrance, and then we also have a covered garage for when we're on call or when you're on night float, so you don't have to park in the lot. But it's all free, which is really great.
This is the Women's Center entrance where our laboring patients come in to be delivered. This is also the entrance we come in every morning. What a beautiful view.
This is our main lobby. We come and pass through here to go to Starbucks, and in the winter it's decorated very pretty.
Located centrally in the hospital is the cafeteria, which has a subway and a variety of other stations, including made-to-order meals and grab-and-go stations for snacks.
And here we have one of the most important locations in our hospital, Starbucks.
The hospital also has a 24/7 Tim Hortons, and medical education has coffee as well in the kitchen at Curate. Across the street is the Bing Cancer Center, where we spend some of our time on our gynecologic oncology service.
So this is our same-day surgery center. Also just a short walk across the parking lot from our main hospital. We get the opportunity to do a lot of minor cases here with our private attendings. And it's really nice, it never runs behind, the facilities are really great, and it offers up a lot of extra opportunity for our surgical experience.
We have 3 bathrooms with showers in the call room. We have our medical student room. We are big in education and usually have medical students 3rd and 4th years rotating with us.
We have bedrooms in our on-call suite in case you get a chance to close your eyes for a little bit on a call shift or overnight. Here we have lockers. Each resident gets their own locker. That's yours for all 4 years. You can put whatever you need or want in it. Very handy, very helpful.
And decorate it.
Here we have a main workstation. We have computers, a good view, window.
We have a sectional couch that you can sit and read on or use your laptop on. We also have a kitchenette. There's a full-size refrigerator for all of your lunches or breakfast. New to the call room this year, we have our new Nespresso machine and our hot water boiler and our Keurig.
Thank you for joining us on this virtual tour. You can also see what life is like at Riverside by following us on Instagram, and feel free to contact us with any questions.